Hello and welcome to South Asia Chat, a podcast series brought to you by the Institute of South Asian Studies at the National University of Singapore. The second wave of the COVID-19 pandemic hit India hard, infecting more than 300,000 people each day. While there were many factors that contributed to this surge, this highlighted India's unpreparedness to handle a pandemic of this size. Against this background, Prime Minister Narendra Modi recently announced a new vaccine policy in an attempt to speed vaccination amongst Indian citizens. To tell us more about this initiative, we have with us Mr. Vinod Rai, a distinguished visiting research fellow at ISAS. Mr. Rai has been a senior officer in the Indian Administrative Service and was also the Controller and Auditor General of India. Thank you for joining us, Mr. Rai.
Thank you very much for having me this afternoon, Nitya. Thank you.
As we all have been following the pandemic, the second wave of pandemic that hit India, this led the government to change its vaccination strategy. From allowing states to procure vaccines independently, it has now announced a centralized procurement scheme. In fact, Prime Minister Modi himself made these announcements in his televised address. What are some of the factors that led to this flip-flop in government policy?
Well, Nitya, we've gone through various phases of this policy. In fact, three in this particular calendar year, from January 16 to April 30, the central government, which is the union government, had procured and allocated vaccine doses to the states for free vaccination of three priority groups. And these were healthcare workers, frontline workers, and persons above the age of 45 years. But from May 1, the union government again asked states to procure 25% of the doses from the open market to vaccinate the 18 to 44 year age group. But from June 21st, now every citizen above the age of 18 will be vaccinated free at vaccination centers run by the center or a state government. Now, what happened was that in the previous policy starting May 1, a state could administer vaccine free to the 18 to 44 age group at centers run by the state government. At the central government centers, only the three priority groups, which were healthcare workers, frontline workers, and those above 45, were vaccinated free. But from June 21, both the state and central government centers will administer vaccine free to all age groups. Now, people of all ages will have to pay for vaccination at private centers. However, private centers can charge only rupees 150 as service charge over and above the price of the vaccine. Now, the maximum prices for the vaccine, three different vaccines, which is Covishield, Covaxin, and Sputnik 5, have already been fixed by the center. Now, in the policy change, the center will now directly procure 75% of the doses manufactured by vaccine companies and distribute this among the states to be administered. Now, from June 21, states will no longer have any role in procurement. Private hospitals will have exclusive rights of access to the remaining 25. Now, to be able to weigh in on the reactions of the government, or in fact understand the reason for the flip-flop, as you called it, we need to recognize the basic inadequacy in the government's appreciation of the problem which led to this vacillation in policy. Firstly, government, we must admit, did not accurately estimate the severity or magnitude of the second wave that hit the country. Then there was a lack of self-discipline among the people who seemed to be suffering from what I would call COVID fatigue and kind of let their hair down when the lockdown was relaxed. This behavior accelerated the second wave. The distinct severity of the second wave, which is the Delta strain, also caught the public, the hospitals, and the government totally off guard. Now, government seemed to be following a prudent policy in ensuring the complete vaccination of the 45 plus category before they opened up for the others. This was roughly the time when the states began to criticize the government, the central government, for restriction of the sale or procurement of vaccination. Now, to play one upmanship, the states went on a spree criticizing the center. Now, I sincerely believe that this is where both the sides, the central government and the state governments, played a bit of politics. The central government knew that procurement was not feasible from abroad, as just not enough dosages were available. Knowing full well that even if they relaxed, the states would not be able to procure as not enough was available, the center just let go. Then the drama of the states floating requests for bids commenced. Obviously, no supplier responded. Some said they would supply only to the central government. Now, when about 92 million people in the 45 plus were able to get this, were yet to get the second jab, the center, in a fit of trying to become more politically favorable, opened up for the 18 plus category. This was an announcement, as you rightly pointed out, by the PM himself, but he seemed to have disregarded expert opinion about the supply constraint. And this turned out to be a miscalculation because it made the system very dysfunctional. The supply could not match the demand. Various attempts to overcome the shortage were undertaken, such as lengthening the gap between jab 1 and jab 2. If you recall, earlier it said 4 weeks, then they said 4 to 6 weeks, then they started saying 8 weeks. It was at this time that the states were not able to procure, that the center then decided to pitch in, and having proven the fact that, look, we let go only because you made the request and the demand, we have no option now but to go back to the earlier scheme after supposedly scoring political brownie points. The center reversed the policy back to central government. And it was the Prime Minister himself who thought he must explain to the public why there were these policy flip-flops, that he came onto the television or he came onto national media to explain why this had been done. It was quite undesirable the way it was done. However, fortunately now it seems that the policy has become functional again, and hopefully what the government has announced now will take us forward.
Thank you, Mr. Rai, for that elaborate explanation. And that actually slides in nicely with my next two questions. The first one being on manufacturing capabilities available in India. We have Bharat Biotech and Serum, which are the dominant players at the moment, but we are also hearing of biological E being drawn in. What are your thoughts on India's abilities to manufacture the required doses of the vaccines, and are companies equipped to meet this demand?
Yes, see, considering the huge requirement or huge demand for vaccines within the country, I think India has really no option but to go in for large manufacturing, creation of large manufacturing capability. And this is not that any existing pharma unit can just start vaccinating it, because lots of people have come forth, lots of large pharma companies have come forth and said that they have no plans to get into vaccine production, as vaccine production requires a dedicated facility. Now, we have these two companies who are doing large quantities. That is the AstraZeneca supported vaccine, which is in India, produced by the Serum Institute and is called Covishield. And we have the Bharat Biotech, which is a totally indigenous production, which we call the Covaxin. These are the largest two facilities that we have. Then, with the assistance of Pfizer, we have the BE subunit vaccine, which we are proposing to start manufacturing from 1st of July. Small quantities are being attempted by Zydus Cadila, but it is the Sputnik vaccine on which also we have to put sufficient amount of reliance. Now, Covishield, it is expected that in the period from 1st July to end of December, will be able to do about 50 crores, which means about 500 million doses. Covaxin will do about 386 million. The bio unit will do about 300 million, and the Zydus is expected to do about 50 million. Sputnik will do 100. Now, this will get us to roughly about 1.3 billion. Now, if we can do that large quantity, which is the expectation, but where is the problem? And the problem lies in the fact that as of today, we have done 109, the number of people left to be vaccinated are 190 crores, which means roughly about 1.9 billion people. The doses administered are 253 million only. Now, the current average doses per day is about 31, let me say 3 million cases. If we have to complete vaccination by 31st December, this number will have to increase from 3 million to about 20 million. This will have to increase to about 8 million. Now, do we have the capacity to create such large numbers of doses of vaccine to manufacture within the country? Now, government has tried very hard, and we are ramping up facilities. But as you are aware, that Covishield and Covaxin both require raw materials which need to be imported from the US and the EU. Government has ramped up facilities, and I think a large amount of government-to-government negotiations have taken place in which the US government has agreed to relax on the raw material availability for manufacture of these vaccines. While government is pretty sanguine about the fact that they will be able to manufacture these quantities and supply them to ensure vaccination by 31st December, we feel that this is slightly ambitious. We may not be able to do it by 31st December, but hopefully in about 3 to 4 months following December 2021, government should be in a position to be able to manufacture all the vaccines which are required to provide 2 dosages for the population of 18 plus. That's the position as of today.
Another contentious area has been the pricing of vaccine. The new policy leaves 25% of the procurement to the private sector, where they can charge between 600 rupees to 1200 rupees, which is 12 to 24 Sing dollars per dose. And they've also set a service charge cap of rupees 150 or $3 on hospitals. The government seems to believe that these profits would be enough to incentivize both the vaccine manufacturers and the private hospitals. But do you believe that they are actually good enough for them to ramp up vaccinations?
Well, see, for India, vaccination is going to be a multi-year project, because covering 18 plus in the age group require more than 8 million jabs a day, as I mentioned earlier. And if 18 are added to the requirements, or below 18 are also added to the requirements, it will go on for the better large part of next year also. You may be right in saying that 150 rupees is not attractive enough for companies to go in, or it will incentivize the companies for going in for large quantums of production of vaccines. But in the long run, I would feel that where companies feel that they may make up on volume what they are losing on unit price, I think companies will come forward. And as of now, hospitals who are going to be administering these feel that if they have to administer from the hospital premises, this will just about cover their costs, and they are willing to undertake the vaccination. It's only when the hospitals reach out, conduct camps, or do other mobile vaccination units, run mobile vaccination units, that the price of 150 will become inadequate. Now, that's where some negotiations are going on. And I sincerely believe that government may have to relax this 150 for those hospitals or centers who are conducting camps outside their premises, because there will have to be an outreach program. It may not be possible for the entire population to be able to come to the hospitals or the centers themselves. Government has had a policy of having mobile units doing this. Hospitals have been running mobile units or running special camps in where there was a density of people, so that movement gets restricted as far as the public is concerned. So I think in the long run, governments or the hospitals and the units will be able to sustain at 150 rupees. Maybe in the short run, it does not appear so very attractive.
The new policy also has been silent on the question of imported vaccines. Would this impact the availability of vaccines from Pfizer, Moderna, and J&J?
Well, as you're aware, no supply agreements have been finalized by the government yet with Pfizer, Moderna, or Johnson & Johnson. The government is in fact studying the conditions that these American manufacturers have set, and any decision on procurement and availability will be announced only after the final agreements conditions have been studied and agreements entered into. You're aware of the indemnity clauses that these companies have been looking for. But that said, I would sincerely believe that the government or the public, or the requirements of the country may not be sufficient if we look at imported vaccines. The requirements, the supplies have to be so large, so huge, that we have no option but to set up manufacturing facilities of our own, to ramp up manufacturing facilities which are already available within the country, because these are the only facilities which will be able to meet the huge demand which the Indian public would require to be met if 18 plus have to be vaccinated. And if you add to it immediate requirement, which would require the people or the population named age group to be below 18 also to be vaccinated, we would require a humongous quantity, which I think by imports will not be ever met. Hence, no option for us but indigenous manufacture. And that's why I think the government is not pursuing so severely the issue of imports. Yes, they are looking for waiver on um, production patents. They're looking for relaxation. They're looking for compulsory licensing kind of conditions, but not relying so much on imported vaccines.
The recent struggle to procure vaccines also seems to have cast a shadow on India's image as the vaccine hub of the world. It seems to have dented India's vaccine diplomacy or vaccine Maitri initiative in a big way. In fact, we've noticed that in these past few weeks, China has stepped up its efforts and supplied to many neighboring countries neighboring countries and also those afar. What impact has this had on India's foreign relationships, both with in its neighborhood and outside, especially when we have had in the past countries like Brazil preferring Indian vaccines over others?
Yes, I do acknowledge that India has been caught off guard on this, and that we had started the vaccine Maitri program or the supply program internationally, taking into consideration the fact that we had what we felt at that point of time a large vaccine production capability. But in the second wave, India's growing deaths due to COVID-19 have certainly taken the sheen of the government's diplomacy during the COVID era. With more than 300,000 cases a day, India is today a country with the biggest surge at present. Of course, it has declined much below that 300,000 cases that it had peaked to. But in the past year, it has also been the country with what I would call the biggest heart, lifting its ban on exports of the drug HCQ, if you recall, when there was a demand for it, sending medical teams to countries in the neighborhood, and then for its massive vaccine Maitri program, under which India exported more than 66 million doses of COVID-19 vaccines to 95 countries worldwide. China, of course, has exported 80 million doses to about 60 countries, but only after it managed its own internal COVID-19 crisis, which means it had vaccinated its own population. Now, finally, if we look at it, India was the second worst affected country after the sharp contrast of the worst affected in the United States, which has, through the use of executive orders, that's the United States, through the use of executive orders and its Defense Production Act, made domestic production and use of COVID-19 vaccines and farmer supplies its priority, refusing exports as at present. Now, that was the time when Prime Minister Modi had declared that India, this was in January, February, that India had walked the talk. And he said that at the global summit of the World Economic Forum. So why do you say, as the government now is facing criticism for its diplomacy? Well, I would say, firstly, for not anticipating the current crisis and sending out what I would say an incorrect message internationally that India had defeated the coronavirus. That is when Prime Minister Modi made that statement. But at that time, India was seeing about 11,000 new cases a day, and nationwide, about 150,000 active cases. Today, that number has grown and had peaked to about 350,000 cases. Secondly, the criticism against India or within India was that we started the vaccine export program at exactly the same time as the domestic vaccination program began, believing that we could manage both simultaneously. While a case must be made for vaccines for the immediate South Asian neighborhood, as a pandemic in any neighboring country will obviously necessarily impact India also, but the criticism is about assisting countries further afield when they could have been used in India. These 66 million doses were exported while India's entire vaccine program over 3 months from mid-January to mid-April has given 130 million doses. This meant that at the very least, India exported what could have been used for a month of vaccination domestically. But please understand, even when we put a slight suspension on our program, the IMF and other people have come forward to say that India is not meeting its global obligations. So India was caught up between, on the one side, domestic requirements, on the other side, the global commitments that Indian companies had committed to. Now, on the other side, take what the US Department's response was. When asked why it wasn't clearing exports of vaccine ingredients to India and excess vaccines, it said that it was not only in America's interest to see Americans vaccinated first. They felt that Americans should be vaccinated first. It was in the global interest, and that's why they did not allow it. Now, that is the kind of a situation that we got unfortunately caught in, and hence we had the difficulty of committing to export, but running up into a situation where the domestic demand went up so drastically that we had to cut down on some of our export commitments. It was a unique problem, but like all other countries, India has met with its export obligations substantially, despite the fact that it is now being called upon to meet its indigenous requirements.
And finally, my last question also pertains to the India-US relations. Like you rightly said, initially the Biden administration did not respond very forcefully to India's COVID crisis, though it later agreed to provide raw materials for the AstraZeneca vaccines. But recently we've read about Vice President Kamala Harris speaking to Prime Minister Modi and assuring the US support. And the Biden administration has also announced the withdrawal of priority ratings of the Defense Production Act, under which it could not export previously. What do you think, what would all this mean for India and its relationship with the United States?
Oh, well, we must accept the fact that India's relationships with the United States are fairly deep, and these relationships have been deepening over the years, may not be, and they are not limited to vaccine supplies or commitment towards vaccine raw material supplies only. There has been a huge amount of cooperation during the Quad. There has been collaboration in climate change. As you see, Prime Minister Modi speaking to the G7 group of countries gave his commitments to the various objectives that the G7 wants to follow on. But of course, the move by the Biden administration, and in particular, Vice President Harris ringing up the Prime Minister directly, is a watershed moment for the US. All right. But the US secured the first hundreds of millions of doses made on its soil for domestic use, but intends now to be an engine of vaccine production globally. But they have the wherewithal, they can afford to do it. They have got herd immunity now, and their vaccination coverage program is proceeding very rapidly. Now, as vaccine demand wanes at home, the Biden administration is obviously facing calls internationally to release the US stockpile of shots made by Pfizer, Moderna, or Johnson & Johnson. But again, the issue is that the quantities that the US can release, and 60 million is what is being talked about, will be very, very inadequate for India's requirements. But yes, it has been a very positive move on the part of the US administration or the Biden government to relax provisions of the Defense Production Act and ensure that India and other countries do get the raw material that we require. So it's a huge step, a positive step, which will help deepen relationships, strengthen relationships. And as I said earlier, the relationships cannot be limited to vaccine only. They are very wide and deep. And I hope that going forward, these will become strong.
Thank you, Mr. Rai, for joining us on this very insightful podcast. It was a pleasure having you as our guest today.
Thank you very much. Your nice set of questions, which did cover the entire gamut. It was a pleasure.
You were listening to South Asia Chat. To learn more about our work, visit us at isas.nus.edu.sg. Also follow us on our social media handles, Facebook, Twitter, and LinkedIn. Thank you.